Listen to the following talk.
New provisions in the draft law amending and supplementing certain provisions of the pharmacy law. The pharmacy law, passed by the 13th National Assembly on April 6, 2016, replaced the 2005 pharmacy law. This marked a critical step forward in improving the legal framework governing the pharmaceutical sector in Vietnam, aligning it more closely with the growth and international integration of the industry. The 2016 pharmacy law comprehensively regulates key areas in the pharmaceutical field, including the state's pharmaceutical policies, pharmacy industry development, pharmacy practice, drug business operations, drug registration, circulation, and recall, as well as herbal and traditional medicines, prescriptions and drug use, drug information, pharmacovigilance, and drug advertising. It also covers clinical pharmacy, drug management in healthcare facilities, clinical trials, bioequivalence studies, quality management, drug safety, and pricing. This law has fostered a more equitable and open business environment, supporting companies in ensuring the consistent supply of quality drugs at reasonable prices. The domestic pharmaceutical industry has achieved a level 3.55 rating on the World Health Organization (WHO) scale. Over 7 years of implementation, the pharmacy law has contributed significantly to the industry's growth, laying a legal foundation that encourages transparency and innovation in line with international standards, including good practices for all activities, from manufacturing to retail, ensuring quality drugs for consumers. Through various mechanisms, policies, and legal documents, Vietnam's pharmaceutical sector has seen substantial development, supporting public health protection and care. However, some practical demands have revealed limitations in the current legal framework. These include 1. Administrative obstacles in drug registration and circulation. 2. Inadequate quality management policies that lack local adaptability. 3. Stagnant policies hindering pharmaceutical industry growth. 4. Outdated drug pricing regulations. 5. Drug business regulations that need updates to match current development and integration trends. 6. Burdensome drug information and advertising regulations for businesses. And 7. Gaps in the registration, production, and distribution rules, especially under emergency circumstances for pandemic, security, or defense needs. To address these issues, an amendment to the pharmacy law is necessary. The draft law is built on 5 key policies approved by the National Assembly, aimed at 1. Ensuring an adequate and timely supply of quality drugs for public health needs. 2. Ensuring drug availability to meet national defense, security, and emergency response needs. 3. Enhancing drug export-import management, adapting to economic and social growth and international norms. 4. Promoting pharmaceutical industry development, prioritizing research, technology transfer, and the production of innovative and high-tech drugs, standardized herbal and biological medicines, and local medicinal resources. 5. Restructuring the drug business and distribution system to support economic, social development, and global integration. These policies address urgent, practical challenges, particularly lessons from the pandemic, aiming to secure drug supply for healthcare, streamline administrative procedures to support businesses, and promote decentralization and responsibility at all levels. The draft law amends 44 articles within 8 chapters out of the 116 articles across 14 chapters in the 2016 pharmacy law, with the following major points. 1. Institutionalizing special mechanisms. The draft law formalizes special mechanisms that were not included or fully addressed in the 2016 pharmacy law. This includes emergency provisions for disease outbreaks like COVID-19, enabling flexibility in importing and utilizing raw materials, recognizing drug approvals from trusted regulatory agencies, and waiving technical review requirements for specific cases. 2. Encouraging pharmaceutical industry growth. The amendments introduce breakthrough policies to attract investment in drug research and production, particularly for new medicines, high-tech pharmaceuticals, and drugs for specialized treatments. These policies support activities such as technology transfer and the development of new medicines from local resources, fostering self-reliance and industry growth. 3. Diversifying business and distribution models. To increase drug supply and accessibility, the amendments recognize new business models such as pharmacy chains and online drug sales, aligning legal frameworks with global economic and technological developments. They also expand business rights for foreign invested enterprises, FICE, allowing them deeper involvement in Vietnam's pharmaceutical supply chain. 4. Simplifying procedures for drug registration. To expedite drug approval and ensure timely patient access to quality drugs, the amendments reduce administrative requirements for drug registration renewals and simplify procedures, shortening processing times and allowing continuous drug circulation after expiry under specific conditions. 5. Decentralizing drug recall authority. The amendments grant provincial health departments authority to handle mandatory drug recalls, enabling quicker responses to quality issues, safeguarding public safety, and aligning responsibilities with other product quality regulations at local government levels. 6. Adopting international standards for good practices. Recognizing International Good Manufacturing Practice (GMP) standards ensures a stable supply chain of raw materials for Vietnam's drug production, reducing risks of supply disruptions. 7. Reducing business barriers. The draft law removes certain business conditions to create a more favorable environment for businesses, enhancing regulatory oversight and flexibility. 8. Updating quality testing methods. The amendments allow flexibility in testing methods for certain drugs, especially vaccines, enabling cost savings for businesses and faster market access. 9. Strengthening price control measures. To stabilize drug prices and limit price markups, the law will manage drug pricing based on declared wholesale prices, in line with the 2023 price law, ensuring affordability and transparency in drug costs. These updates, based on the 5 approved policies, aim to resolve existing shortcomings in the state management of the pharmaceutical sector. They will help sustain sector growth and ensure the consistent, safe, and affordable supply of quality drugs for Vietnamese citizens in the future.
Summary of the draft revised law on amendments to the law on pharmacy. The law on pharmacy, ratified in 2016, represented a significant advancement in developing Vietnam's pharmaceutical legal framework. This law established comprehensive regulations across various pharmaceutical aspects, including state policies, pharmacy practice, drug business, quality control, traditional medicine, and clinical trials, which supported investment and industry growth, achieving WHO-recognized development milestones. However, after over 7 years, certain limitations and outdated provisions have emerged, prompting the need for amendments. Key policy enhancements in the draft revision. 1. Ensuring adequate drug supply to meet public healthcare needs, security, defense, and emergency situations, with an emphasis on timely provision of quality drugs. 2. Strengthening import and export management, improving alignment with socioeconomic developments and international standards. 3. Boosting the domestic pharmaceutical industry, prioritizing technological innovation, research, and production of advanced and traditional medicines using local resources. 4. Optimizing drug distribution systems, reorganizing distribution to support economic growth and integration. 5. Simplifying administrative processes, streamlining drug registration and supply chain regulations to benefit businesses without compromising drug safety. The draft also includes over 40 specific revisions to bolster Vietnam's pharmaceutical capacity. These cover pandemic response flexibility, support for research and development, introduction of new business models like e-commerce, streamlined registration, enhanced local and international production collaborations, and improved drug pricing control. The revisions aim to create a transparent, efficient framework for the pharmaceutical sector, ensuring timely access to safe and affordable drugs for Vietnamese citizens.
This content is just an example for learning English. Thank you for watching. This is a VTP channel. How do you feel about this video? Please leave a comment below.